welcome to our next Empowering Your Health Community Health Seminar. Today's topic is on mind and body, managing chronic um, health conditions with behavioral health. Before we get started, just wanted to make a couple of announcements. So recently we have transitioned our platform. So if you would like to sign up for press releases and community newsletters, I will submit that link in our chat. For any questions for our panelists during the seminar, feel free to use the Q&A or chat feature. And yeah, I will pass it off to our panelists today. Thank you for joining.
Hello, everybody. Thank you for joining us. I'm not sure, can everybody see the slides? It looks like there's
I don't think you're sharing them
a
yet.
banner there.
You might have to reshare them.
Replacing the current share. Okay. There we go. I think Gray had taken over our sharing. Okay. So tell you a little bit about us. My name is Skyler Meyer. I am a doctor of nursing practice. I'm the chief of integrated primary care here at ADAPT. Um, I have been in nursing for 27 years, a nurse practitioner for the last 14 years, and I think about 13 of those have been here at ADAPT. I have lived in the Roseburg area my entire life. Grew up here, went to Douglas High School, graduated from Umpqua Community College with my first associate's degree in nursing, and have been in the area ever since. I enjoy the outdoors, hunting, off-roading, camping. Those are kind of my hobbies, and of course, spending time with my family. So, Dr. Hart.
I am Dr. Hart. I'm ADAPT's Chief of Behavioral Medicine. My training is as a clinical psychologist. That's my background. But I've really been working in medical settings for most of my career. So although my training is in mental health, really working in that place where mental health and medical come together. I have lived in Roseburg and been with ADAPT since 2014, and I love living here. I was new to the community, moved from halfway across the country, but I really found a home in this community, and love exploring outdoors, but also traveling far away when I can.
Which she does. I can attest.
So today or tonight we're really talking about that connection between medical and physical well-being and mental health. So for most of history, for a really long time, medical systems have treated the body and the brain pretty separately, siloing care into care for your body, for medical care, and then mental health care in different places with different providers, different treatments. But we know that the brain and the nervous system are part of that same body. The brain and the nervous system change in response to stress, in response to trauma, and that exists inside of a body that is also changed by stress and trauma. So really the separation of mental and physical healthcare has created some pretty big gaps in diagnosis and treatment and how we approach well-being overall. So we really can't fully treat any part of our health, physical health, chronic conditions like diabetes or pain management, without also addressing our emotional and mental health. This really begins at the most basic level. Our bodies are wired in such a way that our bodies and brains really developed and adapted to a very unsafe world. So you think about, thousands of years ago, our ancestors really existed in a world where there was a lot of danger in day-to-day life from weather, from predators, from other objectively dangerous situations. So you can imagine that, going about your day-to-day life, maybe picking berries, you might run into a saber-toothed tiger staring at you from the bushes. So our bodies were really designed to respond quickly to that kind of danger. So in that situation, the brain very quickly puts in motion a series of responses to really kick the body into high gear very quickly. You may have heard of the fight or flight response, and really this is exactly what that is talking about. It's a system that quickly mobilizes the body to face danger head on. So your heart beats faster, your muscles might get tense, your breathing might get faster. You might notice that you're sweating, or even feel nauseous because your digestive functions start to slow. So, despite the fact that we live in a very different world, our bodies and brains are still wired this way. But we're not dealing with saber-toothed tigers. The stress response that's really helpful and important when facing a physical danger isn't really all that helpful when the thing that you're facing is having to make a phone call. Um, so, all of those physical sensations that come along with the fight or flight response don't help us navigate most of the types of stress that we face on a day-to-day basis. But this really has an impact on our ongoing health. So if this system is being constantly activated through stressors where, we're not having to fight a bear on a regular basis, that fight or flight response can really start to have some impacts on your health long term. So, so some other examples of this, just to help illustrate what this looks like in day-to-day life. Our brain sees or experiences a threat. Oftentimes, again, it may be things like having to make a phone call. It might be, me tonight having to speak publicly. Feel a little bit of that fight or flight myself at the moment. But our brain sees and responds in that threat and responds to it by activating that response. There's some short-term physical symptoms that come along with that. But if that is not dealt with effectively, there's some more long-term symptoms that can come along with that as well. You can kind of chronically be in this fight or flight mode that's really not helping you function in your day-to-day life, and really can make you feel significantly worse over time, um, and start to get into that fight or flight mode more easily. So it's really a cycle of physical and mental and emotional health that can become pretty problematic for your well-being. Another example, perhaps living with chronic pain. So one thing we often notice in people who have pain in their day-to-day life is their mood is worse. They have increased risk for depression. When people are depressed, often it's harder for them to get out of bed and move around and engage in the physical activity that we know is important, which both impacts their physical health and prolongs that low mood, which again is going to be a cycle because if you're not moving your body, your pain is going to be worse. So really, when we're thinking about managing our health, our physical health, taking into account our mental health, we really want to start thinking about how we can disrupt these cycles, and kind of realizing that this is all happening within the same body. So whether you're dealing with a medical diagnosis or mental health diagnosis, that's very interconnected.
Is this this is mine?
Yeah, I'll stop
Sorry.
talking for a minute.
All right. So when we think about chronic stress and your body's physical response to stress, stress can do have a lot of impact on our lives. Just as positive things can have positive benefits on our health as well. But when you think about things like chronic stress, it can increase your risk for heart disease by up to 40%. Stress causes inflammation within the blood vessels. It raises blood pressure. It affects how your heart functions. It affects how your body is able to process sugar, store fat, particularly around your midsection. Think about your inner abdominal fat is very much related to cortisol and a stress hormone. Um, so it increases your risk for developing diabetes and other metabolic disorders. It makes you more susceptible to things like infections because of immune responses that are decreased, slows your healing process. Um, Stress can accelerate aging. There's actually a protective cap on your DNA that called a telomere that can be shortened by stress, chronic stress, um, and can contribute to things like dementia. So people with a history of trauma, depression, anxiety accumulate health problems faster than those without these conditions at a rate similar to the effect of those with obesity or people that smoke. Um, if they don't have obesity and they don't smoke, but they have stress, they can um, accumulate those chronic conditions just as fast. So, um, specifically thinking about women that have both depression and anxiety, when you put both of those together, it can even accelerate those development of chronic conditions even faster. So this is a little diagram that kind of shows how significant those impacts of mental health and physical health are associated. When you look at things like COPD, which is chronic obstructive pulmonary disease, uh, you see, a correlation that is about 3 to 1. And traumatic brain injury, which you think of injuries maybe not as associated with mental health conditions, but when you're talking about brain injuries, it could be that you had a mental health condition and therefore you had increased high risk behaviors, and therefore you're going to have more risk for traumatic brain injuries. Or the other direction, it could be that you had a traumatic brain injury, so that increases your risk for mental health diseases. But it doesn't have to be injury. It can be, things like cancer or coronary artery disease. Those people with those conditions are more likely to have mental health conditions, and those people with mental health conditions are more likely to have those conditions as well.
So when we talk about stress, we're sort of talking about stress generally, but also in some kind of specific ways, whether that is something that would meet the criteria for a mental health disorder or specifically trauma as well. And this really begins in childhood. So there is a study that is the initial study was the Adverse Childhood Experiences Study that started with over 17,000 participants. The body of research on this has really grown over time. So at this point, we've looked at hundreds of thousands of people using this kind of framework of understanding the connection between our experiences and our mental health and our physical well-being. So this is a huge study that tells us how these types of events during childhood impact our health over time. So the types of events we're talking about are things like having a parent who is diagnosed with a mental health disorder, having a parent who is incarcerated, experiencing violence in the home, experiencing substance use in the home. So kind of a range of experiences, but we can kind of see that children who experience one ACE, one adverse childhood experience, tend to experience multiple ACEs. At almost 40% of this initial sample reported two or more ACEs, and about 12% experience four or more. 87% who have one adverse childhood experience have more than one. So this is really common. I think if most of us were to kind of go through this inventory, most of us would identify having experienced at least one adverse childhood experience. But this, from childhood, this is something that can begin to impact our health. And similar to the graph that Skyler was sharing, you can really see that these have a strong connection with our physical health. Pretty much any aspect of your medical health that you can measure is associated with ACEs. So the more ACEs you have, the higher your risk for developing cancer, heart disease, even broken bones, the higher your risk for substance use. And it really has this kind of stair-step model where the more ACEs, the higher your risk. And there's sort of ideas about why this is the case. Probably, as we've talked about, stress and trauma change your body, change how you process information, how your brain works. So that certainly has an impact. Developmentally, this is obviously a really vulnerable time for brain development, so it's important to be aware of that. But also through our behaviors. So folks who experience trauma are more likely to engage in behaviors to cope with that trauma that can sometimes have some negative outcomes. Substance use being a common example. And this is true starting in childhood. And I always like, when I'm talking about this with a patient, I always like to put a little bit of hope in there too, around positive childhood experiences, which have a protective factor and an important consideration. So I don't want anyone to get the message that you're doomed if you experience trauma or you experience stress, especially as a child. Our bodies and brains are actually incredibly resilient. And there's a lot that we can learn and do that can protect us from these harms, but can also help us heal our brains and bodies. And we'll talk about some of those strategies later on. Even as we continue through our lives, our experiences shape our well-being. So beyond the impact of stress in childhood, we are impacted by current stress. So if there's a lot of things going on in our life at the moment, chronic stress or traumatic stress, and the behaviors that we do because of those things. So it is a really normal response when you're not feeling well, to change your diet or to change your level of physical activity or to change how you are interacting with other people in your life. All of those things will impact well-being, which will continue to impact those behaviors. So again, I like to insert a little hope, a little optimism, and just note that a lot of these things are things that we can change and have a lot of opportunity to address. So I don't want this to feel hopeless.
So I want to just switch gears a little bit and talk about the impact of substance use on your health. And one of the reasons I want to highlight this is that a lot of these things impact your mental health, but a lot of these things, our behavioral health consultants can be great resources for us to intervene in some of these high-risk behaviors. So I'm going to throw out a lot of stats at you real quick that relate to some of the things that some of these substances can cause. So, alcohol is the leading cause of death in the United States, or the eighth leading cause of death in the United States, contributing to approximately 178,000 deaths annually. Some examples of conditions that maybe alcohol can cause include liver damage, cancer, heart disease, brain damage, dementia, something called Wernicke-Korsakoff syndrome, which is a short-term memory loss where you can't create new memories, um, digestive system problems, and nutritional deficits, weak bones, and other neurologic problems like neuropathy. Neuropathy is a condition that can cause painful sensation when there's no actual trauma or pain being experienced or cause. Marijuana. Marijuana increases your risk for coronary heart disease by more than double. Actually, 2% versus 0.9% in those that don't use marijuana. Heart attacks, strokes are actually increased by a significant amount, 2.6% in those that use marijuana and 1% in those that don't. Respiratory disease, regular marijuana smoking can cause chronic bronchitis, persistent cough, wheezing, increased phlegm production. Among people who vape marijuana, three or more times uh, in each day in the past month are 23.2% increase experience bronchitis symptoms compared to 12.3 in non-users. Cancer, marijuana smoke contains carcinogens similar to tobacco smoke. Marijuana hyperemesis syndrome is something that will cause chronic nausea and vomiting and often lead to malnutrition. Mental health disorders, especially those in high potency marijuana, those greater than 10% are significantly increased for something called psychosis. Generalized anxiety disorder. It can precipitate or worsen bipolar disorder, schizophrenia, and major depression. Marijuana is associated with increased suicidal thoughts, especially those with underlying depression. It can cause impaired cognitive abilities, and it can cause pregnancy complications and dependency. One thing that is not included in here that Dr. Hart and I were talking about earlier today is the disruption in sleep that marijuana causes. Alcohol is very similar in that, and that some people use it to facilitate getting to sleep. But then when those levels start to decline, it can make you wake up because your body is dependent on that to initiate sleep. And it can also disrupt your ability to go into REM sleep. Methamphetamines, included cocaine in here, although we don't see very much of that in our community, can lead to cardiovascular diseases such as heart attack, arrhythmias, or irregular heartbeats in your heart. Aortic dissection, which is where your aorta that comes off of your heart can actually rupture. Pulmonary hypertension, atherosclerosis, heart failure can lead to psychosis, delusions, cognitive impairment, schizophrenia, Parkinson's disease, dental issues, infections, and malnutrition. Opiates, being either prescribed opiates or illicit opiates, depending on how they're used, can have different risks. But opiates in general, with the opioid epidemic, have reached proportions beyond what we've seen in the past, exceeding deaths from firearms and motor vehicle accidents in certain age groups, increase all cause mortality and overdoses, hormone dysfunction, heart attacks, arrhythmias, respiratory disorders like sleep apnea, bowel dysfunction, opioid-induced hyperalgesia. That's where you actually have increased sensations to pain because your pain receptors are dysfunctional after long-term use. Can increase your risk for falls, fractures, can cause immune suppression, and lead to mental health conditions such as depression. Can also lead to dependency in and to opioid use disorder, with misuse estimated at approximately 20 to 30% of long-term users, and that includes long-term users who are prescribed medications as well as those that use it illicitly. Tobacco. Most people know the risks of tobacco. It leads to it's the leading preventable cause of death worldwide. It's responsible for over 8 million deaths annually. Some associated conditions: cardiovascular disease, stroke, aortic aneurysms, heart failure, arrhythmias, hardening of your arteries, high blood pressure, blood clots, cancer. Cancers can include not just lung cancer, but also cancers of the larynx or throat, oral cancers, esophageal cancers, bladder cancer, kidney, pancreas, liver, stomach, colon, uterine cancer, and even leukemia are associated with smoking. Respiratory conditions such as bronchitis, chronic bronchitis, emphysema, asthma, increase your risk for infections. Can increase secondhand smoke can increase your like children's risk for ear infections and also respiratory infections as well. Smoking actually increases your risk for diabetes, increases infertility, causes erectile dysfunction, immune dysfunction, dental disease, and more. So, as you can see, these are definitely not good for your health overall. So now let's talk about the reverse or inverse of this and how mental health conditions can impact chronic physical health conditions. So when you have depression and anxiety, or other mental health conditions that can significantly increase your risk for developing other conditions. Studies have shown that 31% of people with chronic diseases experience depression, compared to only 11% of healthy individuals. Of people with experiencing cancer, 67% of those are also experiencing depression. 38% of people with diabetes have depression. Heart disease and stroke increase your risk by 30 to 40%. Arthritis, chronic pain, arthritis increases your risk for depression by 30%. Respiratory diseases like COPD and asthma significantly elevate depression risk. The more conditions that you have, the increased risk for other mental health conditions, specifically depression. And this relationship is true regardless of your age. So most people that as they age get more health conditions, so that would increase your risk more. But even those that are younger have this same increase in risk.
So, for me, I think there's one thing that I hope everyone takes away is that your physical health and your emotional and mental health are the same. They exist in the same body. And we really can't effectively treat one without thinking about the other. So, one of the things that I love about where I work and the getting, I think what has kept me working in medical settings for, going on 2 decades as a psychologist is that I have seen, and I believe that that's how we best treat health is through treating stress, through offering interventions that we know have a positive impact on mental health and physical health, and working alongside medical providers to really treat health from a holistic and thoughtful perspective that doesn't rely only on medication, that we're able to treat people more broadly.
Yeah, I think about mental health conditions, but I also think about physical health conditions that there are a lot of non-pharmacologic treatments that are available for both. And a lot of times when you use those non-pharmacologic treatments, they impact both of the mental health and physical health conditions equally. So you can get dual benefit.
So we're going to end with a few strategies and then obviously leave some time for questions. But really focusing on science-backed strategies to help you manage your mental health and stress to have a positive impact on your physical health. Um, the good news is that most of the things that you do to support your mental health likely have an impact on your physical health as well, starting with sleep. Um, I would say, regardless of what somebody is coming into primary care for, sleep is something that comes up over and over and over again, whether they're kind of presenting for care for a medical condition or for a mental health condition. Sleep is so important. And I always feel slightly hypocritical having this conversation because I too, struggle to implement the strategies that I should all of the time. So if you're struggling with sleep, certainly you want to diagnose and treat underlying causes. Sleep apnea is one that people are frequently familiar with. But alongside that, really is starting to implement sleep hygiene, and we'll go into some of those strategies on the next slide. But often sleep hygiene alone isn't quite enough. So there is an intervention called cognitive behavioral therapy for insomnia. That is the gold standard treatment for insomnia, and really is as effective as medication in the short term. But when you look at people over time, those who receive CBTI actually have prolonged improvement without the side effects of medication. So this is really a go-to treatment for difficulty with sleep.
I would just second the mental health or behavioral health treatments and those modalities as far superior to any medications. There are really no effective medications that are good long term for supporting sleep that is both effective without side effects and allows you to continue to have good regenerative sleep. Most of them disrupt the sleep cycle. They may help you get to sleep, but they actually are long term can cause more harm than benefit.
So thinking about sleep hygiene, and these are kind of things probably many of you have heard before, from your doctor, from the internet, but there's kind of a series of things that are good in general to practice when it comes to getting good sleep, which again is really a basis of good health. Is keeping a consistent schedule, not having it when possible, this isn't always possible for everybody, depending on your work schedule and other things, but really try to go to bed at the same time and get up at the same time every day. Um, it's If you are somebody who has trouble falling asleep, sometimes a relaxing pre-sleep routine that sort of cues your body and your brain that it's time to relax can be helpful. Maybe reading a physical book, doing some gentle stretches, meditating. Some people find a warm shower effective, and really give yourself a routine and time to wind down before sleep. Um, Avoiding screens is helpful as well, because those can be both physically arousing through the light of the screens, but also a lot of the things we look at on screens aren't relaxing topics. So that's another thing to kind of keep in mind. Um, and then having an environment that is supportive of sleep. Most people sleep best in a room that's cool and dark and quiet. Um, so if you can invest in some blackout curtains, some people find white noise machines helpful, or even earplugs if you live in an environment where quiet isn't as readily available. Um, and also only using the bed for sleep and intimacy. So you don't want your brain to start associating your bed with watching stressful TV or streaming on your phone or even eating. You really want your brain to associate your bed with sleep. And then, caffeine is a big one. So if you're sensitive to caffeine, or if you're not sure if you're sensitive to caffeine, I'd really recommend, trying to cut off caffeine consumption in the afternoon. And alcohol is the same. Alcohol has, like um, Skylar mentioned earlier, really does have an impact on sleep, and especially the ability to stay asleep and get good restorative sleep.
One quick thing I would add to the sleep schedule. I find a lot of patients, have a good time when they want to go to bed and a good time when they want to wake up. But a lot of times those times are a long ways apart. They're like 11 hours apart, and your body doesn't need to be in bed for 11 hours. And so it's not going to be beneficial for you to go lay down when you just woke up, 13 hours ago. So be mindful of that, be cognizant of when you want to wake up, and just, back your time up from that point by, 7, 8. Even 9 hours is reasonable, but beyond that, you're gonna really struggle.
So second to sleep, the other thing that people really love to talk about is physical activity and how important it is. But unfortunately, like we can both confirm that this is one of the best things you can do for your physical and emotional health. Um, about kind of like the recommendation that floats around, and this is based on research and science, but it's not just pulled out of nowhere, but it's 150 minutes of moderate activity per week. So I think where I like to put a small caveat is that if you're going from no activity and trying to jump to 150 minutes per week, that can both feel really daunting and may not be a positive experience. So anything is better than nothing. Even 10 minutes of movement can have a positive impact. So even if your 150 minutes feels impossible, starting somewhere is important. Strength exercises are also important, especially balance exercises as we age. Um, and find something you enjoy, both because you're more likely to stick with something that is fun and enjoyable. Um, and you may already be doing things like gardening or walking your dog that you enjoy that count towards that physical activity that you might not be thinking about. And context matters. So, especially for mental health benefits, you're going to get more benefit from doing something that you enjoy and that feels meaningful to you than if you're trying to like force yourself to do something that you hate. So for me, I've tried to be a runner for like 20 years of my life, and I try and I hate it and I fail and it's awful. So finally, I had to accept that that is not it for me, right? And so I found other things that I enjoy and can stick with. and that have more benefits for me. So again, unfortunately, this is true.
Be mindful. We do live in the Pacific Northwest, and if you're only focusing on outdoor activities, that may limit you in your ability to get physical activity during a large portion of your year. So try to mix it up a little bit. Try to find some things that you can do indoors, maybe even just in your living room. But maintain that physical activity even when you can't go outdoors.
So, if I'm going to give two recommendations, it's work on sleep, work on physical activity. And there's a whole host of other things that we can do that are effective in both managing our mental health and our physical health. And one of those things, kind of broadly, is calming our nervous system. So there's many different ways you can do this. Again, if you're new to exploring what this might look like for you, I always encourage you to like pick one thing and try it. So if you decide you're gonna try meditation, for instance, like really try it. Like give yourself an opportunity to experience that and focus on that before deciding whether or not it's for you. And don't try to create like a million new habits at once. Really focus on one at a time to sort of build these skills. So breathing is really important. There's a nerve that goes from your gut to your brain. And one of the things deep breathing does is stimulate that nerve and helps calm your nervous system. Mindfulness and meditation are other things you could try and consider. Um, uh, or, some people struggle with meditation. It's certainly a skill, but some people, it's just not for everybody. So if you're a person who gets more benefit from movement, you could consider things like progressive muscle relaxation, walking, and even gentle stretching or other restorative movements like yoga or Tai Chi, can be beneficial for calming your nervous system. A couple of other recommendations, quick things you can try if you notice that you're, having those panicky feelings or feeling a lot of stress in your body. Um, Splashing your face with cold water, putting a cold pack on your chest is one way that can quickly calm your body. Humming, and then also being mindful of caffeine and alcohol intake. Those are both things that um, in larger quantities can increase anxiety and stress in kind of sneaky ways sometimes. It's also really important to stay connected socially. When we look at people who stay healthy throughout their lifetime, one of the big components of this is social connection. So whatever this looks like for you, um, I always encourage people to be thoughtful about how they can stay connected with important others, and access those supportive relationships. Um, Social support buffers a stress response, so which in turn can reduce your risk for negative health outcomes. It helps you feel better emotionally, supports your mental health. And, if you're trying to do a new behavior, like you decide you want to walk on a regular basis or go to the Y and take a water aerobics class, whatever that may be, having someone that you can do that with is a really practical support that helps people be more successful with behavior change. So really, social support, staying connected, and if you are lacking social support, investigating where are places I could go, where are opportunities to maybe meet new people and build some of these types of relationships. And then finally, treat stress. We've talked about kind of like coping skills, day-to-day stress, and that's important. Those skills are important. Including processing emotions immediately. Don't let them kind of fester. Don't ignore them. Um, but find a time and a place when you can kind of deal with the emotions that are coming up for you. Set healthy boundaries with others in your life. Use self-care. And there is a time and a place to seek additional mental health treatment. So if this is something that you might need, obviously there's resources here to adapt for that, and many other resources available in the community. But therapy can be really effective. For depression, for instance, mild to moderate depression responds as well to therapy as it does to medication. So
Without the
certainly
risk of side effects.
without the risk of side effects, mostly. Different side effects
Mhm.
potentially.
Yeah, yeah.
Um, so definitely reach out for help and seek treatment um, for your mental health and for your physical well-being as well. And it looks like there was one question. Do you want me to read that, Skylar?
I can't see it
Okay.
because
Um,
I'm sharing my screen.
yeah, well, I'll read this and then if other folks have questions, please feel free to put them in the places where Gray suggested.
Hmm.
Does ADAPT make referrals for patients to connect with domestic violence victim services, a referral to Peace at Home, etc.? Those things contribute to depression, chronic stress, and physical pain. Yes, absolutely. Peace at Home is an organization we work with regularly and are really thankful to have them in our community. So yes, that's definitely something we both screen for in primary care and work to connect people with the resources they need.
Other questions? Is that all we have for now?
That's all I saw. Oh, here's another one. So from your clinical experiences, where do you most often see the disconnect between treating mental health and physical health as separate? And what would truly integrated care look like in practice for that patient?
I think that I see the disconnect in kind of social or the expected norms. Like it's not something that most people think are as connected as they are, and so they're pretty resistant to that and understanding or and accepting that connection. Um, I think one of the things that can really um, help when patients uh, maybe are a little bit resistant, but are willing to explore the opportunity is having a warm handoff. That's something that we have here in our primary care with our integrated behavioral health consultants, is that we can reach out to them and almost always find somebody that we can have them meet with same day while they're meeting with us as well.
And I would say, historically, and I think for many of us, there has been so much stigma around mental health. And so one of the things I love about working in an integrated setting is there's an opportunity to really normalize that as a part of healthcare from the first time somebody comes into the clinic. So, again, we've really treated these things in two different systems, but I think we've done a real disservice to people and to healthcare in general by separating mental health and physical health.
And we've made the connection on how much how often it is that people will have both, but that behavioral health component can also help manage when you don't have a mental health diagnosis, but you just have a physical health diagnosis, but you need to some additional help with making that change. So developing a change mindset to integrate things that are healthy, like good sleep or exercise or changes in your nutrition. So you don't have to have that mental health diagnosis or concern for behavioral health support to be very beneficial.
And I have yet to meet a single person who does not experience stress. So that's I would say a universal experience that impacts us all in one way or another at some point.
Thank you. Does anybody have any other questions for our panelists tonight? We'll give it another minute for any final questions.
Grace said, new question coming in.
Okay. Someone is saying they need to start focusing on their sleep.
Yeah, don't we all?
Yeah, so
So,
Okay. Do you want me to read this question, Summer?
sure.
Okay. What, in your experience, is the best way to discuss mental health care concerns with a friend who only wishes to go to their normal doctor? Um, I mean, hopefully their normal doctor works in an integrated setting, and we're fortunate to live in a community where many of our primary care clinics have behavioral health consultants and mental health providers there in the clinic. So, hopefully there's some like exposure there. But one thing I like to talk about is stress, right? Again, that's a universal experience. It's something that impacts us all. And I think can be a term that feels less stigmatizing and less scary, maybe, than maybe a diagnosis of depression or anxiety. But really try to find language that um, someone feels comfortable connecting with.
And I would just add, if they're really just wanting to go see their, primary care provider, their physical health provider, however you would state that, to encourage them to be open with their provider about talking about what their provider feels would um, would be the risks and benefits of additional behavioral health support. Sometimes just having that encouragement from their medical provider to seek additional help outside of medications can be that thing that tips them over the edge, knowing that they also agree that that is beneficial.
It looks like there's one more question. How do you decide if an individual has a like physical illness, physical medical condition, or if they might be presenting with like stress-related symptoms or other things?
Can you reread that?
How do you decide if an individual has a
Okay.
physical illness, a physical diagnosis, or if they might be maybe have other motivations behind seeking treatment?
So a lot of times it comes down to a really good history, understanding their symptoms, the onset of those symptoms, how their symptoms are changing over time, what they've tried. And then sometimes it comes down to some testing and ruling out some physical health concerns. There are some physical health concerns that certainly will mimic some mental health conditions and vice versa. So usually it comes down to a really good history, detailed, trying to determine the constellation of all of their symptoms and how they may fit together and how they may make sense for something that is medical versus something that may not look medical and then testing to rule out medical conditions or rule them in if those are present.
Well, and unfortunately, I think sometimes it's been communicated like things are all in your head, right? And that is not true. Just because, let's say, you have a pain that isn't caused by, burning your hand on the stove, you still have you still have pain in your body, whatever the source of that may be. So that's not something that's being made up or that someone is pretending. That's your nervous system response to a stimulus. It just may not be a physical stimulus. So I think that's important, as we're caring for people, um, to treat the person who's in front of us with all the tools that we have. And sometimes that's ruling out certain medical conditions, but that doesn't keep us from also addressing stress-related symptoms or other things that might be going on.
100% agree.
Yeah. So lots of questions, it sounds like, coming in from Facebook, but we are short on time. So one last question. Can you talk about your mobile crisis and regular crisis teams and what kind of work they do and how this helps with these things? Do you want me to take that one?
Yes.
Okay.
Yeah, I
I would
think you're a
say,
little bit
yeah,
more
neither
out.
one of us are really the experts in the
Yeah,
crisis team. We've worked pretty consistently in primary care. But ADAPT does have crisis teams, amazing crisis teams that work both in our Madrone clinic and then out in the community as well. So I don't want to misspeak on the work that they do, but would encourage you to definitely look online and get more information at our website.
Yeah, and I can add a little bit too. So we have walk-in hours at our in Roseburg. If you come to our Roseburg clinic during Monday through Friday, um, mobile crisis is separate. They're dispatched, um, working hand in hand with law enforcement on mental health emergencies. They try and de-escalate situations in the moment if it's something they're not able to handle. If it's more on the medical emergency side, they will, um, work hand in hand with EMT and other medical providers to get the help they need. Um, but yes, I definitely encourage to visit our website for more information. And I just want to thank everybody for joining today. I want to thank Dr. Hart and Dr. Meyer for being our panelists tonight. Um, if you're interested in continuing and attending our seminar series or newsletter, receiving our community newsletter, feel free to subscribe. And we hope to see you next time. Have a great evening. Thank you.